Our sexuality is a pretty central part of our lives. It's like really very basic to anyone's life, you know? So to overlook that is just like, let's just talk about all this up here and let's just not look down there. You know, it's like that kind of thing, and it's like,
I think it's very important to speak with your healthcare provider about your sexual health because it'll give you more insight on things that you may not be aware of. As we know, things are constantly changing, so your healthcare provider would be the best person to keep you informed.
While I grew up and everything was some sort of taboo that you could not really speak with your doctor or a GP or anything of this sort. And also, like, medical-wise, it just makes sense because, like, we're just a whole, so why not talking about such an important part of our body?
I feel like a lot of people might not be as educated as they should be about infections and how they can affect your everyday life and affect your health later on down the road.
If a provider can actually help educate some of these people, it probably could lead to longer and better health benefits in the long term. So.
I think it's important for healthcare providers to prompt those conversations because oftentimes people only get information from their families or from the people around them.
They're already asking you personal questions about like what you're eating, what you're doing, how your health is, and I feel like there's kind of like an interconnection between that and your sexual health.
I think our society has the idea of specialization pretty much baked into the healthcare system, but I think it would still help being brought up with a general practitioner to show that it's inclusive.
I think it's good for both to kind of take the initiative. I believe in like opening up the forum so that the person can speak.
It should be a provider to introduce that because I feel like sometimes patients might be a bit apprehensive with just kind of sharing that information. So I think it's important that they kind of start that to get the ball rolling so that the patient is more open.
I think it does help if the provider, being the person with the greater experience, were the one to say, so tell me what's going on, in your sex life.
I think it's an ideal state. The provider should be operating from a place of trust with the patient. Obviously, everything is ideal, but because that power imbalance does exist, the provider is in a perfect opportunity to actually help guide their patients through whatever they're dealing with.
I think it's important for the provider to provide like the introductory of the patient's like health history, and then the patient will feel more comfortable with sharing that knowledge with them.
Still just greeting them, saying good morning, or just making them feel like they matter outside of just a chart, outside of just a number.
Like making eye contact, remembering their name, taking time to actually listen to what the patient is saying.
In one instance, I brought up STI testing to my healthcare provider, and the way that they reacted was a little off-putting because they were like, oh, what did you do? Or, oh, what happened?
I wouldn't be offended by that at all. I'm there to provide information about my health and my concerns, and they're there for that same purpose.
No. Well, I'm older, first of all, so I'm definitely comfortable speaking about it.
I don't think I've ever been offended, nor I would ever be offended, because it's just their job to take care of my health.
I'm really open about this topic, so I don't get offended because the doctor is not someone in the street that you are talking to, but it's an important person.